In Sudan, Doctors Without Borders has issued a new report detailing what it describes as devastating stories of violence, hunger and a collapsing healthcare system in South Darfur as war rages on there. Let's bring in, from Doctors Without Borders now, Emergency Health Manager in the area, Dr. Ali Almohammed. Dr. Almohammed, a very good evening to you. Welcome to SABC News. So you say that violence, insecurity and hunger are devastating in South Darfur. Paint us a picture of how that is affecting the local population.
Good evening. Thank you so much for inviting me. Yes, the situation in South Darfur is really poor, and the violence is impacting a lot the population. There is lack of humanitarian assistance in South Darfur. There is attack on people. There are violence against civilian and infrastructure. I mean, in our report, we mentioned between January 2024 and January 2025, more than 650 survivors of sexual violence receiving medical care in our supported clinics.
And on the issue, Doctor, of sexual violence, these more than 600 people who've been sexually violated who are in Doctors Without Borders care. So these are only the cases that you know of because you're helping the patients. You say they were harmed, more than 50% of them were basically sexually assaulted by what you describe as non-civilians. What do you mean by non-civilians? Who is doing the raping and the sexual assault of these people?
Yes, so these 650 survivors were the one who received care at our clinics or supported clinics. So the number is expected to be much higher than that. And in our report, we are really focusing on the testimonies of the survivors. So when we are saying more than 50% reported that they were assaulted by armed or non-civilian person or armed groups, this is really based on their testimonies. They mentioned that some of them were in military uniform, some of them were in police uniform, and this is what we are reporting.
And is there any effort by the local authorities to ensure that, or at least pursue justice for the sexual assault victims?
So far, and based on our experience and based on our teams in the area, there is no any accountability. There is no any mechanism of protection of civilians against any type of violence, not only sexual violence. And this is what we are calling for. We are calling for accountability. We are calling the warring parties to promote international humanitarian law and protection of civilians.
And how much, Doctor, are organizations like Doctors Without Borders able to do for the people of South Darfur, given that you've described the healthcare system as being in ruins?
So, since the beginning of the conflict in Sudan in April 2023, the humanitarian aid and assistance in Darfur is really limited, and it doesn't really meet the need. And MSF in South Darfur, we have been there since January 2024. We are supporting main referral hospitals in Niala and in other localities. We have been supporting many local initiatives and local providers and volunteers to provide medical care. Not only medical care, we are also supporting some local initiatives with cash grants. We did food distribution, targeted food distribution. We supported some local NGOs with financial support to provide community kitchen and school kitchen, and we are also supporting MOH with providing medical supplies and assistance to the health facilities. But the response is really not enough. UN agencies are not present in South Darfur. International organizations are really moving poor, and this is really challenging for us.
And what about then your criticism of the lack of adequate international response? An adequate international response, A, I would imagine, to advocate for an end to the fighting, but B, to also drum up support in terms of aid to be able to help as many people as possible. What should the international community be doing? And what are you able to do currently for the people who've been maimed, injured, orphaned even, for those children and the victims of sexual violence, given that your resources are somewhat strained?
We are calling all the humanitarian actors to increase funding and to be present in Darfur, and also to really work with the local communities and to increase their support and funding. And this support and funding should be flexible, should be substantial, and should be also sustainable. And we are also calling warring parties to guarantee the access of humanitarian aid and humanitarian workers to be able to work in the conflict affected areas, because working also in such context is very, very, very complicated and difficult.
And lastly, Doctor, the issue of hunger. Speak to us about the provisions that the average Sudanese person in this conflict-affected area currently has. What does their daily diet look like currently, and the impact then of a population that's going hungry but is also in need of medical attention, because nutrition also affects how quickly or how well you recover in times of sickness and injury?
Yes, so this is another challenge, because we are dealing with the consequences of food insecurity in South Darfur. We are treating malnutrition. We are providing some food ration for the patients with malnutrition, but we are not really treating the main, or we are managing the main cause of malnutrition, which is lack of availability of food or access to food. There have been some food distributions in some areas in Darfur, but it's still not sufficient, and without sufficient food supplies and food distribution and also increase the access of humanitarian actors that are focusing on food security, and we won't be able only to deal with malnutrition cases.
Dr. Ali Almohammed from Doctors Without Borders, thank you so much for speaking to us on the situation in Sudan, in South Darfur in particular.